Hi everyone, my name is Slezins. I'm board certified neurosurgeon practicing in Riga, Latvia. And today's topic is how can brain tumor manifest itself? So generally there are just three groups of symptoms how can brain tumor manifest. The first group of the symptoms is related to volume. So skull, we can imagine it as a closed structure, and roughly inside the skull there is only brain. Of course there is some blood in the vessels, there is a CSF, but for a matter of simplicity we can imagine that there is only brain inside the skull. If something else starts to develop, to grow and occupy space within the closed structure, then less and less space remains for the brain. And because of that, first group of the symptoms can develop, which is headaches. Headaches are produced by the tension put on the meninges. So the brain is covered with meninges and brain itself is painless, but the tension applied to meninges can produce headaches. And some nausea and vomiting also can be a part of the story. And group of symptoms number 2 is neurological deficit. So as we all know, brain has a lot of functions, and most of the functions are located within a specific area of the brain. Let's imagine the speech is located in left hemisphere of the brain and in specific areas of the brain, which means if the tumor develops within that specific area of the brain which is responsible for speaking, patient can present with speaking difficulties or comprehension difficulties. Another example, area which is responsible for arm movements is also located within a specific region of the brain. If tumor develops in that region of the brain, that this function, movement of the arm, can be affected. So which means depending from the size and location of the tumor, it can present with some kind of neurological deficit, which means some kind of the brain function deficit or deficiency. It can be anything. It can be weakness, it can be inability to speak, it can be inability to comprehend someone else speaking, etc., etc. Neurological deficit also can manifest as a personality changes. For example, some parts of the brain are responsible for your personality, for the way you are, so for the way people know you. And this can be changed by the tumor. Therefore, if someone develops changes in habits, personality, becomes completely different person, this can be a brain tumor as well, because this is a neurological deficit. Group of symptoms number 3 is seizures. As we all know, brain uses electrical activity as a way of operating. If there is any kind of tumor inside the brain or pressing on the brain, it can cause a storm of electrical activity which manifests as a seizure. Therefore, if someone is having a seizure for the first time in his or her life, he or she needs to be checked for the brain tumor by doing MRI scan, just to stay on the safe side. Thank you very much for watching this video. Please subscribe to our channel, hit the like button and leave your questions and comments in the comment section.